We're starting with all the stuff you need to know about magnesium now. I do not push a lot of medications. I try and go the non-surgical route, the non-medication route as much as possible. But for these supplements, there is just so much evidence. All my family members, myself, I take this stuff. I think it makes a huge difference, and the research is unbelievable at this point. We're going over all the new research. Like I said, the tips and tricks, how much you should be taking, what my favorite stuff is, what are the human trials showing, what are the best new doses to take, and what is most effective in a practical guide. The blood-brain barrier means the arteries in the brain have something called tight endothelial junctions. That means not as much can squeeze through because the brain wants to protect itself from toxins, and there's astrocytes and parasites to clean up anything that squeezes through. And comparative studies do show that magnesium L-threonate is the best one so far at getting through the blood-brain barrier. So those studies show cognitive benefits such as improved memory, learning, neuroprotective effects, potential benefits in enhanced memory and learning. These are all new studies, but there are some higher level studies that look at 100, 200 people, and the results are statistically significant. Even sleep quality, protecting against brain inflammation, neurodegenerative disorders like peripheral neuropathy. The typical dosage is 1,000 to 2,000 milligrams because the vast majority of the weight of magnesium L-threonate is that threonic acid. If you're taking 2 grams of magnesium L-threonate, you're only really getting 144 milligrams of elemental magnesium. The studies that they used, that's really all they used. So you don't have to take like 10 grams. That would be pretty expensive as well because this is not the cheapest form of magnesium. It is proven to penetrate the blood-brain barrier a little bit better than the other ones. Our brain is at its peak size at age 25. And after the age of 40 years old, every decade, our brain actually shrinks 5%. It's not functioning as well. That's just the reality. The older we get, and once we get towards the end, our physical capacity does unfortunately decrease. At 70, it shrinks even faster, and statistically, we have less cognitive function. This is a very sad and sobering reality that happens to all of us. It will, and there's not much we can do. And number 2, cognitive decline. In the study that I'm looking at, 1 out of 9 people over age 40 said they think their memory is getting worse. Anxiety and stress, especially after COVID and the lockdowns, that's the #1 concern health-wise for 18 to 34-year-olds, according to a 2022 global consumer survey by the Ingredient Transparency Center. And relaxation and sleep. This is another big concern. Brain size, brain aging, cognitive function, anxiety and stress, relaxation, sleep. These studies go over how magnesium impacts all of these. Magnesium essentially influences the release of neurotransmitters. It modulates serotonin, dopamine, melatonin, norepinephrine. This modifies your mood and sleep regulation. At least 50% of people in America are not getting enough sleep, and 35% are essentially not getting more than 6 hours per night, according to the CDC. We're going to go over the magnesium studies and how they can impact brain health. Specifically, these newer studies focus on magnesium L3. This is kind of the one that's getting all the hype now. We're going to go over whether the hype is true or not true. Essentially, the first study we're looking at, it shows that magnesium threonate can cross the blood-brain barrier. The study I looked at tested magnesium L-threonate versus magnesium chloride. After 24 days, the only one that raised it statistically in this study was magnesium L-threonate. Magnesium does go up in your bloodstream, taking the other supplements, into your spinal cord, and into your brain. Magnesium L-threonate was the best one. Then there was another study for synaptic density. The hippocampus is associated with memory, and as we age, the hippocampus declines. This is known. A mouse study looked at magnesium L-threonate, and essentially mice that supplemented with magnesium L-threonate after 2 weeks had significantly higher hippocampus synaptic density. And in the ones who stopped it, their density then did decrease. There was a second study where magnesium L-threonate decreased inflammation in the brain and impaired memory issues in binge eating mice. That's another one. It can be an anti-inflammatory. And in 2023, there was a post-surgical pain study that essentially showed that mice that had surgery, if they took magnesium L-threonate, they had much lower pain levels and much lower depression and anxiousness in male rats. Whereas the rats who did not take magnesium L-threonate and had the same procedures had much higher stress, pain, and anxiety. Mice don't always translate, we're both mammals, but it doesn't always translate to human studies. But the magnesium L-threonate testing in human studies, there's a lot of good tests coming out, and we're talking in the last year or so. The first one I'm going to look at is a 12-week randomized double-blind placebo study in the Journal of Alzheimer's Disease. The effect of magnesium L-threonate looked at 4 areas. Number 1, executive function, which is planning and juggling tasks. Number 2, working memory, short-term memory testing. Number 3, episodic. And number 4, attention. How well do you pay attention? There was 51 participants in the 50 to 70-year-old study. Magnesium is absorbed well in the blood, kidneys, and red blood cells. They compared different types of magnesium. Magnesium L-threonate, magnesium chloride, which is one of the more popular ones, including that's what's in the creams. And number 3, magnesium glycinate. Magnesium L-threonate was absorbed well in the blood, the kidneys, the red blood cells, but studies showed that magnesium L-threonate was absorbed best in the brain and the central nervous system. In fact, the other ones didn't necessarily raise it. And in all 4 scores, significantly improved memory, cognitive ability, and the 4 functions overall that I mentioned in a composite. According to this study, the difference between taking magnesium L-threonate versus not taking it after about a month, your brain age, the way they defined it in their study, was about 9 years. It made your brain on average 9 years younger. Again, that's just one study with 51 people. They used basically a random existing psychological test, but that was their conclusion. Magnesium L-threonate in a double-blind placebo study was very effective. Another good human study was performed in China. They took 109 Chinese adults aged 18 to 65, and they gave them magnesium L-threonate. This was a double-blind study that compared people who took it versus people who did not take it. They had their standard National Clinical Memory Standardized Test. This was already in existence before that. The score improved significantly in those taking magnesium L-threonate versus those not taking magnesium L-threonate after 30 days of supplementation. And again, some of the other ones show that magnesium L-threonate penetrates well into the spinal cord and the brain, whereas other forms of magnesium do not penetrate as well. Magnesium L-threonate, according to these human double-blind placebo studies, which is one of the higher levels of testing, it was shown to be successful. And the higher you went up in age, the more beneficial the magnesium was. Then there was a third study I found. It was magnesium L-threonate for stress and anxiety. This was also a randomized double-blind placebo study with adults ranging from 50 to 70. They used what's called the Hamilton Anxiety Rating Scale, and subjects weighed between 50 to 70 kilograms. On average, they get into the dosage range, ended up being about 1.5 grams to 2 grams per person, depending on the weight. People who weighed 70 kilograms were about 1.5 grams per day, and patients who were about 100 kilograms, fairly large person, that's well over 200 pounds, took about 2 grams per day. That's more than the standard that's recommended by, the national recommendations. They took it a little bit higher, but a 12-week study on the Hamilton Anxiety and Stress Index showed a significant decrease in stress and anxiety testing. 3 really good, high-quality, double-blind, randomized placebo studies that compared people who took it, who did not take it, and they were both blinded. They didn't know which ones they were taking. Some of the conclusions we can draw about magnesium L-threonate from the studies are magnesium chloride and magnesium citrate, which are the ones that I always recommended in the past, do not build up as well in the brain and the spinal cord. You still get a lot of benefits in the rest of your body, but magnesium L-threonate builds up in your brain a little bit better. And that's not to say the other types aren't good. We just don't know. There's not a lot of studies. Realistically, to draw these conclusions, all of our data comes from basically a few hundred people and studies performed just in the last year or two. who knows for sure what the answer is, but I'll tell you what I'm going to do. I put some of my favorites down below. It is a little bit more expensive, not significantly more expensive than the other types. I used to recommend the powders in the past, like magnesium glycine, magnesium citrate, and magnesium chloride. I like those. Magnesium glycinate. This is a great option. In fact, possibly the best value to benefits. The bioavailability is better than magnesium oxide. Sometimes it's called glycinate. Sometimes it's called bisglycinate. It's the exact same thing. Sometimes you see the term chelated. This means that there's amino acids bound to the magnesium. So you're getting less elemental magnesium per dose, but it's better absorbed. So something to think about. The chelated is generally more expensive and better absorbed. It differs from the other forms because it's bound to the amino acid glycine. Glycine has the benefits of being an amino acid, and it does help with sleep. So in my sleep supplements video, glycine is actually a sleep supplement. So you can check that out below. I won't get into all the science behind it. Magnesium's a sleep supplement, and glycine is a sleep supplement as well. So both can work well together. Glycine is an amino acid. It acts as an inhibitory neurotransmitter in the brain. And when taken before sleep, it is a safe medication for anxiety and does have sleep benefit. There's not a whole lot of long-term studies and can have some medication interactions. For that reason, when I take magnesium glycinate, I take it at nighttime. It's been shown to help reduce anxiety, affect the brain as a sleep aid, and manage stress. In today's world, we're more anxious than ever. Inflation's up through the roof, all this crazy stuff in the media. Who doesn't want a little bit of magnesium glycinate to relax and calm down? I know I do. A lot of my family members use it. It's a great option. The studies are really good. Magnesium glycinate does not cause diarrhea, and it does not work as a laxative like magnesium citrate or magnesium sulfate do. If you're not constipated, magnesium glycinate's the way to go. It can help you with sleep and anxiety as well. The studies are actually really good. There's a lot of studies out. You want to take about 100 to 350 milligrams daily. If you take it in the morning, it's not necessarily going to make you sleepy. I personally take it later at night. It just works well with my diet that way. Magnesium glycinate, you don't have to take over 400 milligrams because you're getting some for food, but 150 to 400 milligrams per day is probably fine, and it supplements the diet. It's much more bioavailable than magnesium oxide, for example. It's gentle on the stomach. It helps with anxiety, sleep benefits. It helps with muscle and nerve problems. But the downsides are there are medication risks. There are overuse risks for this. By overuse, I mean if you're taking a reasonable amount in the recommended dosages, you should be more than fine. Magnesium L-threonate is a little bit more beneficial according to the studies into getting into the brain. Those four major functions, brain function, memory, stress, anxiety, sleep, and pain management, because it penetrates your central nervous system better, it could be indicated that this is the beneficial one. If you have a few more bucks to spend, tell me if it's working for you. I'll tell you, I'm going to try it for the next 60 days or so. I'm going to make a video how it's functioning for me. With one statistic number, it's hard to say for sure. I love to hear the comments. If you're using it, is it making a difference for you? Let me know in the comments. Magnesium L-threonate. It's recommended to take 1,000 to 2,000 milligrams per day. That's what they take in the studies. But that's only 144 to 288 milligrams of elemental magnesium. So the downsides are, this is new. It can get pretty expensive, but the studies are pretty good for brain health, central nervous system absorption. If you want to get that benefit for anxiety and sleep, this might be worth trying. I'm doing a 30 to 60 day test myself. I'm feeling some benefits, but it's hard to say for certain. Now I'm going to count down my favorites from the least recommended to the most recommended good magnesiums. Oxide, magnesium chloride, magnesium sulfate. Magnesium chloride is actually pretty good, but it doesn't make my top list. Magnesium orotate, I didn't go over this because it's a little bit more rare. It's more expensive. They say it's good for athletes and gives you more energy, but is more expensive. It's not the most commonly used. Magnesium taurate, same thing. It's good for diabetics. It's promoted that way. It's good for blood sugar and mood. It's chelated. That's what the taurate is. It helps it get absorbed better. Same thing with magnesium malate. It's good for fibromyalgia. It's combined with malic acid, and it is an anti-inflammatory substance. But again, not the most popular. We're focusing on magnesium threonate. Great for brain function, great for cognitive function, but it is more expensive. And the question is, are you getting enough? I love magnesium citrate. It's a lot cheaper, but it can give you some diarrhea. I usually do it in the powder form. I love the magnesium citrate powder. It's pretty easy. If you're plugged up, you can switch to this one for a day or two, but it's relatively low cost. But number one is magnesium glycinate. It's combined with glycine, which is great for sleep. That means it's chelated, it's absorbed well. Bisglycinate and glycinate mean the exact same thing, and there's no loose stools. It's cost effective, it's well absorbed. That's my number one. So out of all of these, I'm personally using magnesium glycinate right now. I am using magnesium L-threonate recently over the last 30 days.